Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Over the past decade, the prevalence of the disease in Nigeria has been on the rise as over 6 million people live with it and 1.6 deaths have been recorded due to its complications. Ahead of the World Diabetes Day, Mega Lifesciences held a press conference on the 11th of November 2022 at the Radisson Hotel, Ikeja, Lagos, in order to raise public awareness and educate Nigerians on the burden of diabetes and the need to protect tomorrow. Mega Lifesciences is a Thailand multinational pharmaceutical company in over 30 countries globally, constantly helping people stay healthy for as long as they live by enabling access to innovative and quality-assured nutraceutical and prescribed medicines.
Mega Lifesciences is a Thai-Australian company. This company was created 38 years back, and we are currently operating in around 30 countries across the globe. Especially to name in Southeast Asia, we are in Africa available, South America, as well as some countries of Europe. Mega Lifesciences, as a company, we believe in your wellness. And in wellness, we are creating a term or a sentence, you can say, good health by yourself. In this initiative, what we do primarily across Nigeria and across the globe we are doing is we are trying to create various screening centers in which we collaborate with healthcare professionals and provide screening to patients who cannot afford or who are not aware about their health conditions.
Dr. Akinyele Akinlade, a consultant physician and endocrinologist, spoke extensively on diabetes care and education in Nigeria. He urged the public to check their health status regularly and take adequate care of themselves.
We get diabetes not because we drink Coke, not because we eat sugar, not because we eat eba or amala. But diabetes, when we say someone has diabetes, what we actually mean is that the person's body is not able to deal with the sugar that the body generates from the food that person has eaten. There's one chemical that our body produces. It is called insulin. The role of this insulin is to move this glucose into the cells so that the cells can use this glucose to generate energy. But in people who have diabetes, what happens is that the body is not able to produce enough insulin, or is not even producing it at all. And when this happens, it means that there's nothing to move the glucose into the cells. And so the glucose will build up in the blood. And when this happens, when the blood is checked, it is now noticed that the sugar level is high. And that's why we encourage that when patients come to the hospital, no matter what they come to complain about, when they are running their test, blood sugar check should be part of it.
Mega Lifesciences has been at the forefront of driving awareness about diabetes in Nigeria. Our mission is actually to help people to stay healthy as long as they live. And every year we provide awareness campaigns for diabetes and education about management of diabetes. So what do we do from here? Seeing that this is a call to action, we can drive this further by taking these messages to schools, taking it to churches where people are gathered and where we can provide this information.
While speaking on the year's theme, Access to Diabetes Care, Education to Protect Tomorrow, Dr. Elizabeth Oyenusi, a pediatric endocrinologist, mentioned that awareness of diabetes should be created in various places, especially schools, so as to prevent discrimination among diabetic patients.
The person that has been diagnosed with diabetes needs information, needs education to know what to do. And indeed, diabetes is one of those conditions that the day-to-day management depends on the patient a lot, because they come to the hospital, they're given drugs, they are told what to do. when they go home, they're going to do that thing, those activities there themselves. They will have to know the particular foods to take to make sure that they have optimal blood glucose control. They need to know how to exercise, to modify their lifestyle, to change from just sitting all the time, to do physical exercises. They also need to know when complications set in. Sometimes there are no symptoms. It's just by screening, it's just by doing tests that we pick this up. Even though there are no symptoms, it doesn't mean that the diabetes is not doing damage to the organs. So screening and picking on time is very important, and this is why education for the healthcare practitioner as well is important.
We are committed to various education projects. Particularly one of them is the patient education project that we've invested in solely. In the last 5 years, for example, we've been able to reach over 200,000 patients in our quest to educate them on diabetes. Also, we have various platforms via social media means, Facebook, for example. We have reached over 80,000 patients, individuals, on how to know about their sugar. Sugar is one word that a lot of Nigerians are able to relate with. So through our Sugar We Care page, we've been able to have access to a lot of patients. This year alone, we've embarked on that journey, and we are not tiring at all. And that's why we've been able to also reach over 25,000 patients thus far.
As a wellness company, Mega Lifesciences raise awareness on diabetes yearly and increase diabetes care through Good Health by Yourself initiative, where millions of Nigerians get free health screening and patient education programs.
At Mega Life Sciences, we care.